in medical education to master's in educational leadership program. We're excited to have you here and excited for this collaboration. And I love seeing my colleagues in the room already. So this is great. Please note this session is being recorded. So next slide, Jenna, please. I'm Jean Bailey, the Associate Dean for Faculty Development in the School of Medicine at VCU. And tonight, my School of Education collaborating colleagues, Dr. Whitney Newcomb, Chair of Educational Leadership, and Dr. Jenna Lenhart, Recruitment Specialist, and I will share this wonderful opportunity for you to build upon the knowledge and skills you acquired in your graduate certificate, also known as the Time Certificate, and to continue learning through a unique master's degree opportunity. We'll share an overview of the program so you can see how your certificate courses can be used toward the master's program, and we'll go over the application process and give you guidance to getting started. Next slide, Jenna. So many of you have already completed or you're enrolled in the graduate certificate program. In this program, you took 12 credits of coursework covering foundational topics in medical education, including curriculum design, adult learning theory, instructional strategies, and scholarship, along with 2 electives. And the curriculum in these courses was tailored or is tailored to faculty teaching in healthcare professions. And typically, 2 courses were offered each semester. I found learning with you to be an amazing experience, and I'm pleased to share that we have a new opportunity that will allow you to continue your education. So Dr. Newcomb.
Good evening, everyone. Thank you so much for joining us this evening. I'll start off with just introducing some of the faculty and staff in the Department of Educational Leadership. I'm Whitney Newcomb. I am the chair of the department, and we have a great collection of faculty who have expertise in both scholarship and in practice and teaching. And so you'll find a very good mix of tenure line faculty in our department and term faculty in our department. So those who focus on both teaching and scholarship, and those who focus primarily on teaching. And so you got a good sample of our faculty here. Dr. John Becker, Dr. Tamika Ferguson, Dr. Kim Bridges, Cheryl Shakeshaft, Dr. Genevieve Siegel-Hawley. We've had a couple of changes in our staff. Aja Johnson is no longer with us, but we do have Nick Shipman as our administrative assistant. You will see his name pop up a lot. He helps us with and will help you with any type of administrative paperwork types of questions. You can always email or call me as well. But we also have Dr. Driver, Dr. Castro, and Dr. Wilson. I will say that Dr. Driver for years has been the coordinator of our master's programs and our postmaster's programs, and she is retiring as of May 15th. So I'm going to kind of serve in a dual program coordinator chair role until we have her replacement in place. We're hopeful to have her replacement raring to go as of July 1. But as you know, things sometimes get held up. So hopefully at some point this summer, we'll get her replacement in. And you will also see in the fall 2 additional faculty members, because we actually have 3 postings right now for faculty positions, one focused on K-12, one focused on higher education, and another focused on K-12 and or adjacent leaders, those who work in organizations that in somehow serve or are related to education. Next slide. So to give you an idea about what our program looks like, it's a 30 credit hour program. You will be able to transfer your 12 credits from your certificate into the program. The focus is on leadership within educational service organizations. And what you will do is you'll complete 15 of our required, or what we call core or foundational courses. You will transfer in 12 of your certificate credits, and then you will have 1 class or 3 credits of an elective that you may choose. I will say we're working on adding several concentrations, a culturally responsive leadership concentration and a higher education concentration in the next year or so. So there are lots of electives for you to choose from. And so if you are interested in transferring in your 12 credits and coming out with a master's in educational leadership after you complete the 15 plus 3 credits, then I think this is the program for you. So if you'd like to study leadership in educational settings, then we would be happy to have you on board and to join our team. So our schedule looks like this here on the slide. In the first year, so if you decide you'd like to apply for our upcoming fall admissions cycle, you have until July 1 to apply. And then in the fall, you will take 2 courses, Multiple Dimensions of Leadership and Understanding Diversity and Leading for Social Justice. In the spring, you'll take an additional 2 courses, Understanding and Engaging Communities, and then that's where you'll be able to take your elective. We're expecting most of you will be interested in our higher ed electives, but you know, that is, we have several options for you if you're not interested in our higher education classes. And then in the summer, you'll take Educational Research Methods, and that's a course that is part of the program, but is a course that's taught by another department, our Foundations and Research department, just so you know. And then the last course that you'll take with us will be Leadership for Educational Change and Improvement. And so by the end of you'll have completed the program by the end of year 1 as you've gone through fall, spring, and summer, and then you would be looking toward a December graduation.
Thank you, Dr. Newcomb. And so the question of the night that generally is the next question is, okay, so what do I need to do next? So on this slide, and I will share both the recording as well as the checklist after this with Jean, and she will make sure to send out to everybody, and everybody here will receive it directly also from our team. And the admissions checklist you will see is also on the website. Is a modified checklist because what you will do is complete the certificate first, and then you will graduate with your certificate, and then really you're getting a second program with your master's program. So because of that, you've already completed an academic program, and so we're able to utilize some of your past information and past application materials from your last application if you would like to. If you want to submit new recommendations, you of course can, but we try to streamline the process for you in order to make this a simplified process as much as possible. For this group, because this is a new opportunity, we do have an extended deadline for the M.Ed program until July 1st. And so with this deadline for any of the certificate grads, and if you've completed the certificate, then we would need the statement of intent, and there are prompts on the application checklist. We need the references. You have to actually just plug in this email address. You don't have to upload new ones, but you do have to plug this in. Otherwise, it will not let you complete the application or push submit. And then the online application demographic information and the payment fee. So it's a fairly streamlined process for the application process for our certificate completers who want to complete and roll their credits into the Masters of Education Educational Leadership program. So at this point, I will stop screen share so that we can have questions, and I will share those slides and the contact information afterwards. What questions can we answer for everyone here tonight?
Question about the course series. Is there anything that would prohibit us from taking the educational leadership for individual learning or any of the other courses this summer?
Jenna, would there be any reason why we can't do that?
So Kelly, are you currently in the time program or the certificate program?
I graduated from that about 6 years ago.
Okay, perfect. Okay, so there is a time limit. So we would actually, Kelly, want to get you enrolled, but probably, are you currently working at VCU?
Yes.
Okay, perfect. So hopefully, and Jean, I'm looking at you, making sure we can use the tuition benefit. And so Kelly, it would actually be, I know, a little annoying for you, but to do a non-degree seeking application for that, maybe 1 or 2 courses, and then because the program only starts every fall, and so that makes it a little hard to start off sequence. So we have to sort of try to sequence you all so that you can hopefully start in a fall semester. So if you're not able to, if you want to start sooner than that, we would want to do a non-degree seeking application so that you could take those classes. Kelly. Great question.
So I also have a question about those courses. You have list of courses, but you don't really talk about the time when they meet. Do you have those information?
Yes, so those courses will be online. So the instructors of the courses determine how they will run in terms of asynchronous and synchronous.
Okay.
So typically our instructors, we rarely have an instructor who meets synchronously every week. In fact, I don't think we have any faculty who do that. They typically come up with an every other week schedule, or sometimes we have instructors who just negotiate it with their students, depending on what their schedules are. So, but they are all online.
So it is very flexible and it can meet up with all the students evening or during the day, whichever.
Yes.
Okay.
Emma, I think you took yourself off of mute, but do you still have another question?
Doc, thank you. Well, that was my question, but it made me think of another one. About how many hours, because this seems like a bit of a different degree. What's the time commitment, like in and out of class?
That's a difficult question. I mean, I can answer the question in terms of like, what they call it, the seat hours, Jenna. It's about, is it 40?
45. So
45.
they assume, so for a 3-credit class, each credit is what they call, exactly, Whitney, the seat hours, 15 credit out or 15 hours per credit. So it's 45 hours of contact hours. So for an online class, that can vary greatly. And also sometimes I answer this in a way of also, it kind of depends on your confidence level too. So the time it takes for me, I'm a very fast reader. I've done a lot in my life, where for somebody else, it may take them longer. So I like to sort of average, you're going to be doing at least anywhere from 3 to, depending on your confidence and depending on what what your project is, about 3 to 6 hours per class of reading, writing, researching. That can vary per class. Whitney, tell me if I'm way off on that one. But with contact hours and then that, I'd average about that.
Yeah, and that's pretty similar to if it was a face-to-face class, you'd be spending about 3 hours, in a face-to-face setting, and then usually, anywhere from 2 to 4 hours, again, just kind of depending on how, how you work as an individual. And so, yes, I would say that that's right, spot on.
So that brings me to my next question, and I apologize, Emma. I think you jumped on before me, but I kind of took your question away, so I apologize. But it's a 1-year commitment, and because of the time commitment per class, can it be extended? Like, times was really great for a lot of our faculties because how flexible they were. Like, if you can't make it into one semester, they were kind of offering like every other or something like that, where you can finish it, it takes a little longer than 1 year. So how do you guys feel about how this program is set up?
So we're flexible in regard to how we offer this program. So we were trying to, estimate how folks might want to take this. So if you want to take it 2 classes at a time, which is still part-time, and I know everyone, you just like most of our students are working full-time, you could take 2 classes at a time and be finished with, in 1 year. If folks wanted to back that schedule up and take 1 class at a time, we can do that. But what we have to look at is, as a chair of the department, I have to make sure all of my classes meet minimum enrollment. And so what I would likely need to do is create a program that was 1 class each semester for 2 years for all of you together, unless we had enough people from the School of Medicine who wanted to do 1 year and enough that wanted to do 2 years. And so if we have enough interest, we can do both. If we don't have enough interest for both, we have to force everyone into one or the other.
That gets me to another piece also. is so the elective piece, and then also EDUS 660. EDUS 660 is offered every semester. So that can be a really flexible course for you that say in a summer, that summer, it's a busy summer, or there's an elective that you actually want to take in the summer that's offered in the summer and not in the spring. So that's another component of the program that can be a little bit flexible. Some of the other pieces can't be, but those two pieces, depending on the elective, like Whitney said, and depending on when you want to take EDUS, can be very flexible. So I think Kelly earlier, that might be something depending on, what you want to take in the summer, that could be a course that you could sort of take flexibly whenever you have time for it.
Is there a more detailed description of the course content somewhere online? I've looked for that, but I wasn't able to easily find it if that's available somewhere.
Yeah, there should be descriptions for each of the courses in the bulletin.
Gotcha. Thank you.
Yeah, so I'm not gonna lie. I was very excited about this course offering and how the times hours did apply toward it, but the amount of commitment per class, having 2 to 3 hours even after work and evenings. I mean, that's a lot of commitment. That's why I asked if you could do it in 2 years. With children and your spouse working full time, and he and I have to do the tag team. Even wanting to do this, he was also interested in doing it. He couldn't join us tonight because he is tag teaming and taking one of my children to tennis. So, so everything has to kind of fall into place before we can commit to things. So I think that's something that we all need to seriously consider.
I'm wondering, Jenna and Jean, if there is a way for us to survey or poll people who are interested, who've expressed an interest, because we are flexible. Again, we just work, in the confines of, making our classes meet minimum enrollment. But if there are, if the majority of you would like to kind of, what's the word, stretch that out, we can certainly do that. Is there a way, do you think we could, Jean or Jenna, we could get this information? We could capture it?
I suppose we could do a survey to see what would work for folks, just like a quick something so that they can indicate preferences for course meeting times and sequencing. That would be helpful. We could also talk a little bit more about the structure of the time program. I know we've talked briefly about that before, but it really was tailored to the working professional and trying to help folks manage work and personal lives and their development as well. So yeah, we can definitely explore that.
Are the courses that are listed there, are they ones that need to be done in a certain sequence, or can it be easily spaced out over 2 years?
So I will say so we have several different concentrations that are developing in our master's in this leadership studies program, or in our master's of educational leadership program. So what we try to do is offer our core classes across all of the concentrations at the same time, unless we know that we don't have to worry about minimum enrollment. And let's say, for instance, if we have enough time, alumni who are interested in this program, we don't necessarily have to keep those core classes at the same pace that we do the other concentrations. And so that's why, we were trying to kind of guesstimate if we have enough people. So let's say if we've got 15 people who are interested in the program, then we can run on our own schedule. If we don't, and we might have to, have you in classes with other concentrations, then that's when we are more held to a schedule.
Okay, thank you.
And I'll jump in also, even though the time program courses are 2 credits, the amount of work that you all put in those courses is quite robust. So I'm not sure that you're going to notice a heavier burden with coursework that you're having to do, because I'm quite often trying to manage and keep a lid on the amount of reading and project work that you do. So I think you're well prepared to handle a 3-credit course. And if it's 16 weeks, that gives you more time to spread it out, whereas usually we do our courses in 12 weeks. So a lot of variables there that should help to make it manageable for you.
So Jean, I've got a follow-up question for that from kind of the OFA side of things. When y'all are talking about this degree, are you envisioning it as this is something that we are getting permission from our chairs for, that is included in our professional development % effort, or that this is something we're doing as individuals in our own spare time? Because if it is for, like, especially those of us with grant funding, we have to very much account for our % effort, and we would need to know what's the approximate. So I imagine from the student side, it's not 12.5% effort, and that would not be feasible for most faculty to do 2 courses. So like what those estimates would be, or what the approach with this is.
So it's a really good question. And I even wonder if that would vary from department to department and how they view getting a master's. If they see that this is a, feather in the department's cap to have people prepared with ed leadership skills, they might fund it, depending on how they view the professional development. Other places might think, okay, good for you that you're going for this, use your tuition benefit, but we won't include this in any of your load, or won't look at this as part of your responsibilities. So I guess I don't know for sure how to answer that. Anybody else have any ideas for that?
I imagine it's different than time, right? Because time was more around preparing for LCME guidelines and things like that. So I think all of our chairs were more forgiving of our efforts doing that.
Yeah, and this not being, centered, like, part of my my load or my responsibility is teaching the time certificate program, but no one's load is teaching the ed leadership program. So I think you're getting at a really good pivot here for us, is that this is solely School of Ed. Whereas, I support them and what they're in their program, of course, because I want to see this happen for you all. But, that's a little bit more external to School of Medicine, perhaps, than the time certificate is.
So I know that this, particular iteration is new, but the degree itself is not new. So could you maybe tell us a little bit about folks in academic positions versus principals who have gotten this degree, and where that has taken them within higher education to help us make that what's in it for me, what's in it for you argument to our leadership?
Certainly, I can take that question on. Our department has gone through a lot of transformation in the past few years, because we did used to be primarily K-12 focused. We have revisioned our PhD program so that we can be more inclusive. We are revisioning our Masters of Education program and developing concentration so that we can be more inclusive of those who are in those adjacent positions and not K-12 focused. We've done the same thing with our Doctorate of Education, our EDD program, and we've been able to create targeted learning communities. So that's a goal that we've had for the past, I would say, 5 or 6 years in the department, where we've been trying to expand so that we can meet the needs of more people. So our department, even though, historically we were focused on K-12 and that's what our backgrounds were as faculty in the department, we've always had those who are non-K-12 leaders in higher education settings come to us for their degree programs, because for lack of anything else that they had available to them, they wanted to use, employees wanted to use their tuition benefit. And so even though we have been more K-12 focused, we have housed higher education folks in our master's program, our EDD program, and our PhD program for years and years and years. It's just recently we started seeing the trend be that so many more other than K-12 folks were coming to us with need that we knew we had to expand and grow ourselves. And so we've slowly begun to hire faculty who are targeted towards those other adjacent positions. So we have 2 faculty, and we're hiring a 3rd faculty member who are specifically, their backgrounds are specific to higher education administration. In the university setting, we've got a posting right now for someone who has what we call that adjacent background, whether it's nonprofit, some type of other organization that's related to education in some way. So someone who has a background other than in K-12. And so those are the type of faculty that we've been adding on year after year. And even though, faculty hires, that's not so hard to get, especially in the times that we're in. We've got three searches going on right now to expand our faculty, but I will say our faculty, we have made efforts to expand our backgrounds as well so that we can serve the needs of other students. So I would say we're positioned well to offer folks course content and leadership that is no longer K-12 centric. Does that answer your question?
Can I also jump in, Kelly? Whitney, if that's okay?
Yeah.
One of the pieces, Kelly, that your question makes me really think about is the conversation about equity and diversity in higher education. And I think one of the most important pieces is how we as leaders perpetuate or challenge the systems of inequity. And I think this is where this program has a huge opportunity to maybe add a new conversation and a new skill set and a new, I'm sure everybody's doing their own work, but like in an academic setting, in a formalized setting, to talk about leadership and equity and social justice. And so I think that, Kelly, from, I guess, the standpoint of being at VCU, that is a priority and a mission of VCU that you can then, when I'm trying to justify something to my supervisor, at least I'm trying to connect it to the mission, trying to connect it to the vision. I'm trying to connect it to goals and sets. And this, for me, would very well align with that, mainly because it's talking about leadership, but it's also talking about leadership in the setting of higher education, but depending on the elective that you choose. And we are grappling with that right on the medical campus, on the main campus, about how are we serving our students? How are we supporting our faculty and our staff of color? And what are we doing as leaders to ensure that we're coming to work with that knowledge and changing in ways that are really intentional? So Kelly, that would be, from my standpoint, for your supervisor, that's why this aligns well in my mind.
That's wonderful. Thank you, Jenna.
I'll just add to that too. And in regard to our competitors in the area, that's also where we are standouts. Our department, our faculty are all committed, have their agendas. They've taught, in urban settings, or they have scholarly agendas, in equity and leadership. And so those are all things that make us very unique as compared to our competitors in the Richmond metro area. And I'll say too, it's interesting as I think about, I've been at VCU for 13 years, and it's interesting the transition that I see that we've taken our faculty in and of ourselves, because we used to be a K-12 heavy department, and we're at the point where we are the opposite now. So I would say where I wouldn't say that we have those adjacent backgrounds at the majority of us, but I would say the majority of us have foundational leadership backgrounds and broader leadership and policy backgrounds. So there are fewer and fewer of us in the department who are K-12 centric and focused. And I would say that, I would say that we have, in the past 10 years, we have vastly changed. So we are more positioned, better positioned to respond to the needs of an expanded population of folks.
Can I just ask a question? So I guess just speaking to the kind of what's in it for me if I had to, talk to a boss about this, are there other physicians or physician leaders who have taken this type of course and could speak to what sort of how this has helped them jump or transition in their career in any way?
That's a good question, Jenna. I don't think that we have specifically physician leaders, but we do have leaders who could speak to our programs across the VCU campus and at some universities in the Richmond metro area. But I do not believe we have any physician focus.
That's kind of what this was made for. So I think Jean and I, 3 years ago, Jean, when I came on board and I was meeting all the various coordinators and I met with Jean and she said, we need a pathway to a master's program. Like we need to be able to allow for students to utilize the credits and the certificate and the time program to a master's that focuses on leadership and other things that students want to focus on. So Christine, to your point, I think part of this is really out of wanting to provide a new pathway, particularly for people who want to, again, dig in deep, getting back to Kelly's question about diversity and equity as it relates to educational leadership and driving change in those roles. So I think that's really what drove is the interest area into this. But Christine, maybe you'll be the person who will take this and be our, first alum. Who knows?
Thank you. Thank you so much for that esteemed estimation. No, I'm actually trying to imagine what kind of roles someone like me, I'm a family doc, in the department, what kind of roles I might take on after taking this particular course. And is it right for me? And is it right for the group of people that are on this call as it relates to their work?
So I can jump in. I see this really helping someone who is a program director or course director, someone who or aspires to that leadership role, or maybe you're overseeing a residency program of some sort and need to coordinate training for them, or any place where you're coordinating educational training or supporting scholarship, those types of activities. And I think it would be a good stepping stone because well, when I originally thought about this, I thought, okay, how do I do health professions, education, leadership, and higher ed? But the people who come to me asking for something in addition are really saying, I'm not a higher ed administrator. I don't know. I'm a physician. I don't know higher ed admin. And I'm like, cool, because I'm not a surgeon, so I'll do higher ed, you do surgery, and we'll help each other out. I don't want to do the surgery, but anyway, so this is a need that I've had so many people in my office with the deer in the headlights look. They just got plopped into these positions and they're going, help, so that's why when we found out when Jenna and I explored this with Whitney, it's like, yeah, this makes sense. And at the same time, when we've all had our conversations, we've talked about, so how can we keep that med-ed or health professions ed component alive in the masters? And Whitney had some really great ideas for project-based learning, and also maybe cohorts or FLCs, faculty learning communities within these courses that can keep that essence of time that I talked about at the beginning, with the courses focused on med-ed. So yeah, I can see the program really lending to that, because higher ed administration is higher ed administration, whether you're in healthcare or at a university. And so I think there are pieces that would really help you, as well as it's not a master's in health, what do I want to say? MPH. Wasn't a master's in, I'm drawing a blank. What did
Public
I-
health, public health, public health.
It's not a
Yeah.
master's in health administration.
Yeah.
It's different.
Yeah, right,
Yeah.
right. It's not that, but it's educational administration. Thanks, Kelly, for digging me out.
So I completely understand Kelly's concern, especially when we have to bring this up to our chairs, because like times with the education component of it seems really helpful to us as we're teaching medical students and graduate students and all that. But administrative and leadership role is more of our personal gain, looking forward to stepping up or out or beyond. And Do you know what I mean? I know they're supportive of that, and they want us to, you know, grow bigger and better ourselves all the time, but they're gonna ask you to do it without hurting your current position. Do you know what I'm saying? So I think we need some type of language in there, how it's helped the department as well as each faculty takes on this venture. You know what I mean?
I really think the DEI angle is really important and certainly consistent with everything happening in the School of Medicine right now as well.
Yeah.
I think another piece of that that it makes me think of is the School of Medicine, at least, and again, I'm not in the School of Medicine, so correct me if I'm wrong, is always looking for ways to expand effectively into our community to meet the emerging needs of community. And so what makes me think of, you know, Christine, you asked like sort of where does this take me? And then that question can sometimes be sort of like, it depends on where you want to go. You know, that's a little bit about what you want to do. But with the School of Medicine, with sort of the passion for emerging needs of community and meeting the needs that we don't even know yet, you know, what grants are we getting? Well, you have to be a leader on a grant. You have to run grant teams. You have to run, you know, and again, this is my ignorance of how this all works for you all. But when I've worked on grants, it's an intense amount of administration and leadership that is needed to do that effectively, an intense amount. So, you know, is there the connection there that maybe, you know, maybe I apply to more grants and maybe I'm leading more grants. Maybe I'm a PI on an additional larger national grant because of X, Y, and Z. You know, so are there ways to also leverage the fact that this is a leadership skills, which will allow you to grow the capacity of the School of Medicine? But
I like it.
Scott, do you have a question? It looks like you're thinking over there.
I'm just thinking.
Yeah. Thinking's allowed.
Yes.
Aren't we forever thinkers?
Yes.
Would you all be able to share the syllabi from the courses so that we can have a better understanding of what the assignments and the reading loads look like? Please.
Absolutely. Yeah.
Yeah, that'll be really helpful because even though Jean said that it you know, we did put a lot of hours in, but she made it very manageable, understanding our current roles. So I think there was an initial big scare of what it is. So once we see the syllabus and really entails how much I can put in, that actually might be a very big convincing factor for most of our faculty, in my opinion.
Absolutely.
One other question I had about the coursework, I didn't see any mention of a capstone or thesis. Is it correct? There is no culminating project for this degree?
Correct.
Can I make sure I understand one thing? So if it's spaced out, it could be that those who are in medicine are in classes, particularly with the different concentrations you have with other people who are getting this similar degree who are not in medicine at all. Because that was one of the wonderful things about the time courses, that we actually had the camaraderie and the chance to be together as faculty learning together. Is that the case, that it could be more mixed than our experience primarily has been?
It just, yes, it depends. So if there are enough of you that want the program run in 1 year or 2 years, I can keep you together. Yes, and so you'll be like your own learning community going through the courses together. If there aren't enough of you, then, and that's the case for all of our concentrations, then we have everyone, you know, in a big mixing bowl, you know, of the courses. And so it really will just depend on when Jean or Jenna reach out, and we can kind of get a better gauge of how everyone would prefer for the program to be run over 1 year or 2 years. Then I can give you a better idea of you know, how we can roll it out for you if you're interested.
With the other students, are your courses mixed, master's and PhD?
No,
students?
it would be all master's students. Our courses are distinct across each program.
And as I said before, Whitney and I also talked about projects being based in healthcare professions or the medical field or wherever you are. So if there was a mixed group, you'll still have opportunity to focus your project in your work environment. So that might be helpful as well.
Yeah, and that's pretty much the way we've run things as our the backgrounds of our students have expanded, and so our instructors are very used to doing that. But if we have all of you in the same class, not mixed with folks from other concentrations, then we can focus it even more toward you and your needs.
Yeah.
I thought of another question. So if this program is running successfully and we have enough students, is this something we're hoping to plan to be offered every year?
That's my hope. I think that's Jean's hope too. Yeah. Yeah,
And how many students are you, what is the cap?
So if we were going to keep you in a targeted learning community, School of Med time learning community, we would be looking at about 15, a minimum of 15.
Per year?
Per learning community. So each
per class.
Yes, per class, yes. So we would want to look at 15 folks in every class.
You said minimum. Was that the maximum, or do you have a minimum for a course to make?
Yeah.
So the very bottom line minimum is, correct me if I'm wrong, Jenna, it's 12 for the master's program. So the reason that we go up a few more than 12 is in case anybody needs to drop out or a life event happens. We don't want to jeopardize anybody, if we keep to that very bottom line minimum, which is 12. We figure we've got a little bit of a cushion if we target 15 for a couple of people to have snags along the way.
Oh boy, we're gonna have to start recruiting Times certificate students right now, because we're looking at the attendance. There's 16 and 3 of you are already administrators. So
We have more people interested who aren't here tonight. So
okay, that's good. Well, Bennett is one, so we
yeah.
do have one more.
Another, yeah.
Yes, there's another one.
And you said the backup for that is if there's not 15, then we're just in classes with other folks.
Yes, yes.
And our other students, I mean, and I think that there is a big piece to be said about, cohorts are wonderful because, again, your relationships from the time program. Our other M.Ed. Ed leadership folks are coming from a wide diversity of backgrounds. And so having gone through my master's program in a very mixed discipline cohort, it opened up my eyes. And so there's pros and cons to, I think, both sides in many ways. Oh, how adorable, Kelly.
And I will say, so our folks who are entirely focused on K-12 and becoming leaders in schools or leaders of districts, those are typically folks who are in our administration and supervision class or our licensure classes. Our leadership studies students are less typically those who are interested in going into direct school leadership positions. There are some of those folks, if they might want to work in the central office of a school, of a district or something like that, but there are often those who are not looking to become a direct, a principal or a superintendent. Those folks are in the A&S program, whereas we have our other leaders, people who are interested in leadership in other areas or ways or organizations tend to gravitate towards this program, the leadership studies program.
Thank you guys for doing this. I gotta hop off. I'm sure some other people might have some time constraints as well. Who's the best contact person for follow-up questions of the 3 of you, or if there's someone else?
Thanks, Jordan. I would say Jenna probably has the overarching information, and then she'll filter out to Whitney or me if she needs us.
Okay, great. Thank you guys so much. Thank you, Jenna. Thank you, Jean.
for
Thank you,
joining.
Whitney. See you soon. Thanks.
I'm happy to help you with justification for supervisors, because I know that I've had, not at BCU, but at other institutions, have had to justify the desire to do something. So happy to chat with you about that too.